Kokenauer, and McTaggart. Could I have a motion to approve the agenda, please?
So moved.
It's been moved. Is there a second?
Second.
Seconded by Jed. Any discussion on the agenda? All in favor to approve the agenda, say aye.
Aye.
Opposed, same sign. Motion carries. Public comments. Agency reports. There's no reporting agencies today. There is a copy of ABRA's fiscal report, and there's also a preliminary copy available. We could pass it around from the ARC. This is preliminary. They're going to submit a final copy. Finance? Or just next month? In 1 month. So feel free to look at that if you'd like. Next on the agenda, the Iroquois County Public Health Department. Dee?
Good morning.
Good morning.
Good morning.
The first thing I gave you was the grants and contracts list, and even though it looks pretty bare for this year so far, I want to do some explaining to you so that you understand what's happening at the state level. Typically by now, we would have had most of these if it were a normal year. The last 2 years have not been normal, obviously with the state not having a budget and delayed payments, and which delayed allocations for grants and so forth. But we have been notified. I did let you guys know, I'm not sure if it was at the last health committee meeting or the one before that, that the state contract for the eGram system, which is their granting computer system, was terminating on June 30th. So at first the state did a 1-year extension, and now they've signed a 2-year contract. So at least for 2 more years we're going to have eGrams. So they've been waiting on that stuff before they dump the grants into eGrams. Because the state of Illinois also adopted the Federal GATA regulations, Grant Accountability and Transparency Act regulations, they had to jump through some federal hoops in order before they could put out their state grants this year. So that's those are some of the reasons why there's some delays. But we have been notified that these grants are going to start bundling. And so we know that at least for this year, last year, remember, they bundled body art and tanning together, and they bundled, what else did they bundle, Terry, can you remember? Adult care and summer food.
Yes.
Yeah. So this year, they're going to bundle 6 grants along with the local health protection grant, okay? Now remember, we don't have grants for those core programs that the health department has, other than a little bit from local health protection, okay? They don't have their own grants like a lot of these grants do, okay? But local health protection grant is your supplement that helps with that. So with local health protection grant this year, they are going to be bundling body art and tanning again, which we have already submitted. In fact, we've submitted it twice because they wanted it revised for 3 years. Yeah, and now they're going to retract it. But they're leaving it in eGrams until the bundle comes out. Okay. So they're going to bundle that body art and tanning with the local health protection.
So it's only 404 per year, or is it 1,213 per year for 3 years?
I don't know where she got that 404 number. It's supposed to be 1213. It's 1213.
Per year. For total?
No, that's for 3 years.
For 3 years.
That's a 3-year grant.
And
So it's only 404
That's
per
where she
year.
got, 400.
Body art and tanning. That's because we only have. Go ahead, Terry. That's because we only have a few places.
There's only a few places, so it's based on the number of tanning places. If one closes, we're not going to get the funds for that. It has, just like the tattoo, right now we have 2. If one of them closed, we're only going to get funds for one. It's a pay per service.
It's really only $100. I don't know where she got that 403.33. It should be 400.
Well, she divided it by 3.
Well, but her formula is a little different than what's in eGrams. She doesn't see what's in eGrams, but it's $400.
They're paid per service.
Because there's 4 of them.
Gotcha.
We budgeted for 4 of them. The other ones are the lead poisoning case management program. Last year that was $5,500, and last year that was based on you get a certain amount for your base grant, and then you get, last year we got $500 per case that we did case management on, where someone's lead level was over 10, okay? The formula this year is going to be totally different because the state is lowering it down to 5. So anyone who has a blood lead level of 5 or more is going to have to be case managed.
It's all
And
people that ate paint chips.
yeah, you know, paint chips. So that one's getting bundled with it, with the local health protection grant. Safe drinking water is getting bundled with it, and the vector control and West Nile virus grant is getting bundled with it. So that'll come
My only
out.
question is are we for sure going to get the same amount of money, or is this some way
No.
for them to dilute it?
We do not know what we're going to get until it comes out. And the state does have a budget, but appropriations, because that budget came so late, appropriations to the different entities came out late. So we have no idea what our appropriations are going to be.
I mean, it seems like their costs would be lower, because they're obviously eliminating departments and combining them under one department.
No,
No.
not necessarily, no.
No.
No, they're just combining the grants as a bundle into e-grants. But the departments we'll still have to do our individual grant budgets for each grant. We'll still have to do our quarterly reports to each grant. We'll still have to do all of the auditing things that we do for each grant.
Here, I thought somebody was going to save some money.
No.
We're not,
that's
Dee
not
and I
what
were
we're-
discussing, we're not even sure what it's gonna look like in e-grams, because there's set pages you have to, that Dee fills out that has all the common, state legislation, people, stuff like that. In the past, we had to do that for each one of those. They may cut that down and we have to type it in once, but we don't know exactly what they're gonna have in there for the bundle.
My guess is we're still going to have to write, all of the objectives, goals and objectives, all the grant deliverables, all of the initiatives, all the planning processes for each grant. We don't know what it's going to look like, but it's coming. The only other one that I hadn't heard from, that I called on last week, was the Preschool Vision and Hearing Screening Program, which is $3,549 grant, and that's for preschools. And I talked to the state, and I finally got a hold of the director myself who runs that program, top dog at the state level. And she got in her computer system and looked, and she said that our grant will be level funded, so that one will be the same. So those are our grants. Obviously, you can see that Public Health Emergency Preparedness Grant went down from $39,640 to $39,205. Which is typical. I don't expect in the future for these grants to increase. I don't think the state of Illinois has the money.
They should, but they don't.
Yeah. So any questions about the grants and contracts, Jessica? So when those get bundled and we start doing them different, I'll probably go ahead and bring this, but we'll reformulate it so that you can see that together, so that we can separate out what each allocation is, so that you have something to compare it to.
Should we start tracking the total up and down to make sure?
Oh yeah, we do that. Yeah.
My worry is when they bundle that is if
Yeah.
that's something.
Yeah, it is going to go down. Okay. So, we'll see what happens with that. Right now, you guys, I explained to you last month when I went over everything with you, we're a third of our revenue for the health department is through grants and contracts, a third is through our fee-for-service programs, and a third is through the tax levy. So, we'll see how that washes out over the next few years with the state financial situation.
temporary food permits from?
Fair,
Fair.
Ah, yeah.
And little
Should've
carnival
known
type
that.
things, yeah.
as well as the Narga. So you have the 4th of July there at Narga, and, the fair.
Yeah, that's where those are coming from. Terry's here, so if you have questions today on any of this, go ahead and ask him.
Well, I'm going to.
I'd like to point out on the water samples, again, there's a lot coming back bad.
Bad?
Still think that's
16,
from the flooding?
I don't know if it's that, or if, I mean, actually, the number kind of shocks me that it's that low, because we opened up 3 samples to any and
Comes up to
all.
me after every meeting.
There's only 16 people took advantage of it.
Yeah.
Before we were charging, I can't remember what we charged, 15 or 20.
That one.
You know, it's free samples. You can sample your well every week if you wanted to. It doesn't cost you anything other than bringing a sample kit in. The more, you know, you should sample your water well at least once a year. Now we're offering it free, and there's only 16 people.
Make me feel bad.
Especially when you're here on a Tuesday, you could easily brought one in. Let's see. You may see an increase on the well inspections as well as the septic inspections. The reason for this is we're working with the contractors. The state of Illinois, they keep pushing everybody to do more for less or the same. They're wanting more comprehensive inspections, making sure that the artificial drains are installed at least 24 inches below the leach fields. So a lot of times that involves 2 inspections on a property instead of just one. Wells also, they're wanting us to check, you know, we may be there when they're constructing the well. You have to do one comprehensive inspection on a well driller, but then the rest of them is just where you want. Well, the state kind of wants more than the contractor's drilling, like he's going to bring in different casing after he already has the proper casing on the site. So a lot of times there's an extra inspection involved. Typically, if there's an old well sealed, we're going to be out there anyway. It's only on the new construction that it's one final. Normally, new construction, we can also pick that up at the time of the septic that's going in. But you may see an increase over the time, and that also increases the mileage, you know, when you got to make more visits out there. West Nile samples still are holding in there, no positives yet. We haven't had any birds this whole month. Yes, that is good. And we have most of Iroquois County covered. We have a site at Papanow. We have one at Crescent, Cissna Park, Milford. And they run 2 samples
And
a
one
week.
here.
And one here, I'm sorry, yes. So we have the area fairly covered. And again, you'll see more mileage show up on people's time cards for that type of, you know, because you have to run and get them. Yeah.
Okay.
Complaints are actually down,
Awesome.
which is good. We started the liquor inspections. So I think there's 75 of them throughout the year. We'll get to that then, but that should get through my question.
You can see childhood immunizations from the month of June to the month of July almost doubled. That's going to happen next month too, and the following month, because you'd be surprised how many people, you know, they get letters when their kids go home from school at the end of May or beginning of June, but they wait until August, right before school starts, to get their kids shot. That just happens.
Right.
The immunization deadline, according to the Illinois State Board of Education, is October 15th. So children may not attend school after October 15th unless they meet the state-required immunizations or the exemption.
So why is
Regulations.
that? I mean, they're already in school. What if they get something while they're in school?
The state gives them till October 15th. That's the state deadline. That's been the state deadline for years.
It doesn't make sense though.
I don't.
Why not have you?
That's the state deadline. Now, the school districts can shorten that, but that's the last date the school districts can give. But most of them go with the state so that people don't get mixed up.
Okay.
Yeah. So we'll see those numbers start to increase here, and we'll give a lot in August and a lot in September, and even a lot in October. Animal bites, we had 5. So if you look down at the rabies investigations, where it says 4, 3 of those were bats, 1 was cat, and they were all negative. They all tested negative this month. Got lucky. We know that doesn't always happen. The chlamydia cases, if you look at last year's number and look at this year's number, we've already surpassed the cases of chlamydia for the entire fiscal year of 2017. So when I see things like that, then I know it's my job as the health department administrator to get out there and start doing some more education. We investigate each one of those cases, and the people, we make sure that those people are treated. We make sure that their partners are treated. We make sure that they've done follow-up either at a clinic or at a doctor's office. We provide them with a lot of education on preventing spread. But sometimes I think that your best way to prevent some of this is actual prevention, educating people. So when I see numbers go up like that, it's time to get out there and start doing some more education. So that's what we'll be doing. You see that we tripled from last month the number of hepatitis C cases. I've been talking to you about those every month at Health Committee. I don't think that's because we're not actually seeing more hepatitis C cases, and these cases are not epi-linked. In other words, they're not people testing more people for that. So, because the same thing goes with anything. The more you test for something, the more cases you're going to have. Doesn't necessarily mean that something is worse than it was a year ago or 2 years ago. You see that we had some cyclosporiasis. We had 2 cyclosporiasis cases. That is an intestinal illness that people get from a parasite, and usually that is from consuming contaminated food or water. That makes people have, some pretty bad intestinal problems. That's not something that you want to go through.
So where are they getting it from?
Well, they've consumed it. They've either through food or water, and usually, sometimes you can consume it if you're even swimming in water that has that in it. But most of the cases are from people just not washing their fruits and vegetables. They eat them. This parasite occurs naturally in subtropical areas more than it does here in Illinois. But because a lot of fruits and vegetables come from those tropical areas, and people don't tend to wash their fruits and vegetables, or they handle it and then don't wash their hands. We tell everybody every time we do mitigation of any case, your best line of defense, the best way to protect yourself from any kind of illness is hand washing. Wash your hands, wash your hands, wash your hands. And, you would think that would come second nature to people, and it doesn't.
It does to nurses.
It does to nurses, yes. I got the great big rope veins to prove it. Hot and cold stretches those out. But, that's why we want to continue educating people and keep reminding them hand washing is so important. Do you have any other questions? It's pretty self-explanatory. Our senior service programs are obviously very, are obviously. Do you have a blank slide and then,
Yeah.
Yep.
what in the world happened there?
Oh, I just got put on top of it.
I did, sorry about that. Those APS case numbers are still up. The last 6 months have been pretty exhausting. You know, we had our 2 full-time, long-time employees both retire within the last few months since April, and have 2 new people that are doing a fabulous job. They are. They're working hard. One's completed her trainings, and the other one has completed most of her trainings. But it's a lot to handle. So our caseloads are continuing to increase. Champaign-Urbana Public Health Department is going to assist us with our I-plan, which I'll talk to you a little bit about our I-plan over the next few months. At Health Committee, I'll do a little presentation on that. But one of the things that shocked them when they were doing statistical research for us was the amount of seniors in our county compared to the county population. We are an aging population, you know. So a good percentage, 21 to, I think, different statistics showed anywhere from 21 to 26% of our population is over the age of 60. That's a lot. So we have to take care of our seniors.
Yes, I hope so.
We owe it to them. Yes. To serve them well. So our community care program is a program that assists senior citizens to be able to stay in their home rather than to go to a long-term care facility. So that what they do is they arrange for services, community services. They link up those people to community services so that they're better equipped to stay in their home. Sometimes that's homemaker services. Sometimes that's caregiver services. Sometimes that's just somebody who runs and goes and gets their prescriptions for them or gets their groceries for them. Lots of different types of services that we help link up individuals for. And then you guys are aware of the Adult Protective Service Program, where we investigate claims of neglect, abuse, or fraud that's committed against someone who is either age 60 or above, or someone 18 to 59 who is has a diminished capacity in order to make appropriate decisions for themselves. So we see a lot of that too. Unfortunately, when times are stressful, and the county's had some stressful times lately with flooding and certain things. When people are stressed, they tend to we tend to see increase in cases. That happens. So that's unfortunate that we're there. Do you have any other questions? Okay, Terry's going to talk to you about the food ordinance. What we decided to do was give you not yet. I have it here. Sorry. We decided to give you a yellowed copy. So anything that's in red that's got a strikeout through it means we're taking it out of the ordinance, or we're recommending that it be taken out of the ordinance. And anything in yellow is something that we're adding or changing. Okay. So we wanted you to see exactly what we were doing with it in plain and simple terms. The Board of Health recommended that we bring this to the Health Committee. You got one? So Terry worked really hard on this, and so the Board of Health has looked it over at our last month's meeting in July and recommended that we bring it to you. Jim Devine has looked this over and given his seal of approval. So it's ready to come to the Health Committee. Terry will go over it with you, and then afterwards we would like for you to approve the changes if you see fit, and then send it on to for full board approval.
A little background, almost 2 years to the date, Dee and I would have been bringing this to you. Currently, the state law is the 2013 FDA Food Code, kicked in July 1st of 2018. It was put on hold by the state. They pulled it back, so we didn't bring it to you at that time. Now they're still working on it. They're going with the 2017 Food Code, and I'll explain the difference in that in a second. But they're holding all of the county health departments to enforce the FDA Food Code by January 1st, 2019. So this will go in effect January 1st, 2019, and stay in compliance with the state. Now the only difference between, and I didn't bring the code book because they're very cumbersome. It's going in a 3-inch binder. It's almost 3 inches thick, the code. Okay, it's going to a 58 line item instead of a 48. But the main difference between the 2013 and the 2017 food code is Category 2 facilities, which we call medium risk. Your McDonald's is a medium risk, would have to have a food manager on duty at all times, just like the high risk have to. That's the only major difference between the two codes. But like I said, we were going to bring this 2 years ago to you. I served on the committee. I called Dee and said, don't put it on the thing because they're changing everything. So it's been on hold for that long.
Wow.
This is basically our same ordinance as before. What you're seeing in yellow is just to clean it up for the language of the that meets up with the 2015 or 17 FDA Food Code. I know there's a lot in yellow. What I've added is, like before, our ordinance didn't have the category 1, 2, and 3, or high, medium, low. I actually put it in there so it spells it out for everybody. I felt it should be in there. The bottom one, when it talks about core item, if you also look on the other page, it talks about priority and priority foundation. Before, you've always heard me talk about critical violations. Critical violations in the FDA Food Code are now called priority items and priority foundations. So that's where that comes in. Your priority item would be like your food at 50 degrees instead of 41 degrees. You got to get the cooler fixed. Priority foundation is you have to have a thermometer in there so you know what it is. Your core,
Explain it
that
here then?
explains that in there. Your core is like your walls, floors, and ceiling. So, now in the new FDA Food Code, as well as the state, they mandate that you have these items fixed, as you would want to. You don't want people selling food at the wrong temperature. Okay, so a priority item has to be fixed within 24 hours. Unless, for some reason, you would ask for, like a variance, hey, I can't get it done at that, it's kind of bad on the priority because you got to have food at the right temperature. But the priority foundation, you have to have it within 5 days. So if you don't have a thermometer, you got to have one within 5 days. Now that means you will see more inspections because on the sheet, on the repeats, what we call re-inspections, you'll see that those go up, as well as the mileage will go up because they have to go back to make sure these items are fixed. Now, I did put, if you guys remember way back when we passed the first ordinance, we had in there a repeat critical violation. It was going to, if I went to Troy's place and there was a critical violation, item 1 was found. The next routine inspection at Troy's, item 1 was found. That cost him $200 as deterrent because now we have to come back. Those are on criticals. That is still in the code. I changed it from critical to priority. So it's the same as the criticals, with one exception in there. It made it a repeat. remember I talked about the Priority Foundation, the thermometer missing? Okay, the state doesn't care how many times we have to go back to make sure that Troy put a thermometer in his cooler. So in there, I put down, the first trip is free.
Okay.
Troy doesn't put the thermometer in, the next one's gonna cost him $200. So there will be, if he wants to keep paying $200, that's fine. But that will stop all the unnecessary, yeah, because
And well, and not to interrupt, Sherry, but I hope that you guys understand, Iroquois County is the third largest landmass county in Illinois. There are counties you can drive across the county in 15 minutes. We cannot do that.
Right.
So every time Terry has to, not only does it take a huge amount of time, you know, if he's got to run to, say, Loda or, you know, or Shabans or whatever, it's a lot of mileage money as well. And we need to do what we can to put a stop so that people know that we're serious about this. If you don't put you know, they'll run you ragged. Keep coming back, keep coming back, keep coming back, keep coming back. But if you charge them $200 if you're going to come back, they might correct it the first time.
True.
and there is an it says
So if you go back for reinspection and it's done,
there's no charge.
no charge.
It's
Is there
only,
a formal corrective action process there? I mean, is there a form,
well, it will state on,
the inspection report?
yeah, Troy, you need to put a thermometer in your 3-door cooler. You go back and you say, well, I forgot to order, Terry. It's like, fine, Troy, it's going to cost you $200 when I come back in 5 days. And that will then, if you don't pay that, then the $250 late fee that applies to anything gets kicked on top of it. On top of your permit. I mean, I'm not going to close you for that, but it's going to sit out there until your permit's due. Now you're not going to get issued a permit until you pay all your back money. Most people comply, even on the repeats. If they get hit once, it doesn't happen again, typically. And there is on page 9, it talks about alternative timeline for correction. So let's say I dinged Troy on, like, the thermometer, and it's kind of a bad example, but let's say Troy says, hey, the company I ordered from, they can't get it to me for 7 days. Okay, so now it's documented. You know, it's not like, no, Troy, you got to go fly there to pick it up. There is there is a thing in there for common sense that if something can't be fixed, the owner can ask for an extension. The other thing on page 9 that I'd like to point out, previously in the code, or the ordinance, I kept it the way the original was written, is it was once every 6 months. Now I changed it to at least twice per year. The reason I did that was with this new code going in effect and not knowing how many revisits are going to have to be done, because this is a whole new thing to all food establishments. It's a whole new concept that I didn't want to hold myself and the staff to, you know, trying to squeeze everything in if we had a bunch of revisits that had to go. So it's still the same minimum two inspections. Your high-risk places, we have to inspect 3 times a year. The state mandates that. Before, you could get by if the food manager was there. The amount of paperwork the state wants me to submit each time, that Troy's not going to go on vacation, that he will shut down. I'd have to write a 2-page novel on, you know, Troy's shutting down. I can't hold him to it. I mean, it'd be better if it came from Troy that he would shut down, but I have to document it, so we're just doing the 3 inspections. Dee kind of heard me arguing with the state on that.
Oh my gosh, I'm glad it's you and not me. Can't imagine.
But in a nutshell, that's basically it. It's your same ordinance, just tweaking the verbiage of it. The last pages are 12 and 13. There's a lot of yellow. The old code allowed for variances in the verbiage in it, so there wasn't anything on variances. The FDA food code doesn't have verbiage in it, so I had to put that into the ordinance. So if Troy wants to smoke fish, for example, then he's gonna have to do the HACCP procedure over here before I give him the variance. So that's the reason for basically almost 2 pages of yellow at the end. Before, it was, like I said, it was written into the old code, but the new one, FDA, doesn't have a section on variances. So that's the reason it's in there. Because otherwise, Troy couldn't do smoked fish if we didn't have the variance and the HACCP procedure in the ordinance. But you can't do anything that isn't in your ordinance or in the code.
Gotcha.
Anybody have any questions?
We're on page 1.
Page 1.
It says Department of Public Health, Division of Food, Drugs, and Dairies. Why is dairies now included? Did something change as far as...
It probably was in the original, but it was not picked up on the verbiage from the original. What you see in
It's
yellow...
always been food, drugs, and dairies.
Yeah, it's always
at the
been that,
department.
so-
At the department,
I
at the
think
state level.
I think it just wasn't picked up in the original ordinance.
Gotcha.
If you went to Cheryl's desk, you would see that she also, she took it all out of here, was if there was a comma in the wrong place or a comma not added, it would also show up in yellow, but this is just a clean copy of the good stuff, not the grammar.
Yeah.
So apparently dairies wasn't on the first one. But like Dee said, it's always been food, drugs, and dairies.
Yeah. You know, because the Illinois Department of Health has tons of different divisions. They have the Office of Health Promotion, they have the Office of Health Protection, they have Food, Drugs, and Dairies, they have, a bunch of divisions. And all of our grants and contracts and programs fit somewhere underneath those. But there are so many uplines at the state level, it's kind of hard to keep track.
That
Okay,
they change people all the time, too.
They do.
on page 5, part 2,
Okay.
where it says public department,
Page 5, part 2.
so is there a difference in that or what?
Okay, so we changed some of this, and the Board of Health, I took this to them last week. So if you back up, like, say, to page 3, so I can give you a little prelude into this, where it says, under J, where it says Public Health Administrator instead of Board of Health. The reason is, we are one of the only counties in the state of Illinois where I allow Terry to sign the food certificates. Almost all the counties, the Public Health Department, the Public Health Administrator signs all the food certificates. But Terry's been doing this for 30 years. He knows what he's doing. I don't have to go back and check over Terry's stuff. So I allow Terry to sign our food permits, and rightfully so. And the board has backed that from the very beginning. So that's why some of those changes have been made. So that's why someplace where it'll say Public Health Department rather than Board of Health, or Health Department Administrator instead of Board of Health, or Public Health Department instead of Health Department Administrator, because that gives Terry the authority to do that. And I'm very comfortable with that.
As well as it covers us if Dee's on vacation or out of town, technically you can't operate without a signed permit. So,
Yeah, we don't want a restaurant to have to shut down because I'm on vacation.
or open because Dee has to wait, to
Yeah.
come back to sign something. So,
Right.
Okay.
So, and Terry is very well known and very well respected at the state level. He sits on, he goes to the directors' meetings and sits on many of their committees. And Terry's a go-to person for a lot of county health departments across the state to come to for this kind of information. So, he's certainly capable of
Yes,
signing those
I
permits.
agree.
actually it's 32 years now.
32. Wow.
So do we need to move to adopt?
That's
Yes.
what we're asking
Yes.
for.
We have it on the agenda as a discussion and approval of food ordinance. Thank you, Amanda.
Board members,
I move to,
been moved by Barb. Seconded by Jed. Is there any discussion on the approval of the new ordinance? Hearing none. Let's vote on, roll call on that one.
Crumwitty,
Yes.
Awful,
yes.
Kersley,
Yes.
Whitlow.
Yes. Motion carries. Anything else from the health department?
And put some money in there.
Not today, unless you have any questions for us.
Committee members, questions? Hearing none, is there any old business to come before the committee? Any new business?
Yeah, I might have something. I don't know whether this comes under new business or just exactly what, but I want to thank you for coming down to our area and checking out those 2 sites.
No problem.
And I appreciate that. We do down there. And as far as that individual that there's a problem with, I'm going to go over to Derek Hagan's office as soon as we get down here and see if he's got any suggestions on where to go
Sure.
about this guy. He's going to hurt somebody.
Yep.
Thank you.
Any other new business? If none, I would entertain a motion to adjourn.
Make the motion.
It's been moved, second by Jed. All in favor to adjourn, say aye. Aye. All opposed, same sign. Meeting adjourned.